This is a vaccines that we has been tested thoroughly, and it has been given to millions of patients throughout the world. We only now know that the immediate risk is far greater from the virus than the vaccines itself. And this is a vaccine that has been developed by the community of scientists across the whole world. Not one person, not one country. The scientists combined the effort and arrived to the vaccine. We are now much more advanced into our systems that developed the vaccine and into quality assurances, and we have studied the vaccines very effectively. The long-term effect of the vaccine, we know for a fact. We only know the effect of the vaccine from the day we started till we are right now. But based on the clinical data and the studies, we have identified most of the short and long-term vaccine. We've been using it now for a very long time during this pandemic, for at least in Australia since March of last year, and before that in the state, Canada and the rest of the world 6 months before us. In Australia, we had the benefit of studying the vaccine 6 months before us, and right now the vaccine is 1.5 years old, and I can tell you within the 1.5 years old vaccines, we know everything that we need to know about this vaccine. Now, if the question is, what's going to happen in 10 years' time? Now, let me tell you right now, what's going to happen in 10 years' time is exactly what happened in the last 1.5 years. That is what the scientist is actually telling us. But what we know, the effect of the virus right now is much more deadlier to the majority of humanity without these vaccines. The decision is yours. The science is there, the facts are there. We're only following the scientist community and the studies. But if you tell me what's going to happen in 10 years' time, I'm going to tell you it's most likely it's exactly what's been happening in the last 15 months. Thank you.